Our ability to hear is important to us in many ways. It gives us pleasure, for example, by listening to music. It enables us to better protect ourselves by letting us hear sounds that can indicate the presence of potential dangers. But by far the most important aspect of our hearing is the ability it gives us to hear other people speak. It enables us to interact with people, to listen, to learn, and to easily communicate. Our ability to hear can be affected by a number of things. Birth defects, exposure to certain illnesses and diseases, blows to the head, exposure to some hazardous substances, the aging process, and of course by exposure to excessive amounts of noise. Now, of all these potential causes of hearing loss, the most common, and indeed the one which we can most readily address, is the one resulting from exposure to noise, commonly referred to as noise-induced hearing loss. We are all constantly exposed to noise, most of which has no adverse effect on our hearing. But we are probably all familiar with the temporary partial loss of hearing experienced after attending a noisy event or leaving a noisy place. It is difficult to hear and is often accompanied by a ringing or buzzing noise in the ears. With a temporary hearing loss, our hearing will gradually return to normal, usually within a few hours. Any temporary hearing loss should be regarded as a warning signal. Permanent noise-induced hearing loss can occur in two ways. First, from ongoing or repeated exposure to high noise levels, often over a period of months or years. And second, from short-term exposure to very high noise levels, which can lead to immediate damage. The effects of permanent noise-induced hearing loss can range from mild to severe, and will get worse if exposure to unsafe noise levels continues. Permanent noise-induced hearing loss can occur to anyone at any age, and once the damage is done, it cannot be repaired. But the most important fact about noise-induced hearing loss is that it is preventable. In simple terms, the ear works as sound waves pass from the outer ear and cause vibrations to occur at the eardrum. The eardrum and the three small bones of the middle ear amplify the vibrations and they travel to the inner ear. They pass through the cochlea, which contains fluid and nerve cells. Attached to the nerve cells in the cochlea are thousands of tiny hairs that convert the sound vibrations into electrical signals. These signals are then transmitted to the brain and interpreted as sound. The vibrations of different sounds affect these tiny hairs in different ways and therefore produce different signals that are sent to the brain. These variations in the electrical signals enable us to distinguish different sounds. Permanent noise-induced hearing loss occurs when these tiny hairs in the cochlea are damaged. Once bent, broken, or destroyed, they will not function or not function effectively, and permanent hearing loss will occur. The extent of the hearing loss being closely related to the amount of damage to these tiny hairs. Sounds are vibrations that move through substances such as air and water as sound waves. All sound waves have two characteristics: their amplitude, which determines the loudness of the sound, and their frequency, which determines the tone or pitch of the sound. Loudness, sometimes referred to as sound level or sound intensity, is measured in decibels. A whisper has a sound level of about 20 decibels. Normal conversational speech is around 60 decibels, and a pneumatic drill is commonly over 110. Discomfort occurs at 120 decibels, and pain can be felt at around 140 decibels.